Good morning, everyone, and welcome to our newest edition of United We Learn. Thanks for joining us. I'm John Kelker, President of Your United Way, and today we are here to tell you more about 211. During our program, please ask questions using the chat option. We will wrap up in 15 minutes, and United Way staff will stay on to address any questions. If you are watching the recorded version and have a question, please send them to feedback@uwcil.org. Joining me today to discuss our work with 211 is Katrina Hayes, our Director of Community Impact, and Mitch Baker, our Community Impact Manager. In 2000, the Federal Communications Commission designed 211 as the three-digit number for information and referrals to social services and other assistance. The 211 service is provided by more than 200 local organizations that are committed to serving their communities across the country. There are many different kinds of organizations operating 211, including United Ways, Goodwill, community action partnerships, a state-sponsored program such as Indiana, and local crisis centers. The 211 network across the United States responds to more than 14 million requests for help every year. Most calls, web chats, or text messages are from people looking for help meeting basic needs such as housing, food, transportation, and healthcare. 211 is a one-stop connection to local services including utility assistance, food, housing, childcare, after-school programs, elder care, crisis intervention, and much more. 211 is always ready to assist you in finding the help you need. There are more than 200 211 contact centers across the United States, each with a team of compassionate, highly trained specialists who are available to help callers access local resources and the services they need. However, we know asking for help is an extremely vulnerable experience, and we know when people feel unsure, they are less likely to take an initial step. So for those of us who have never used 211, we wanted to share a sample call with you so you know what to expect if you, a loved one, or a friend are in need of assistance.
Good afternoon. This is United Way 211. How may I help you?
Hi, yes, I'm in need of formula.
Okay, this is for your baby?
Yes.
All right. I'm going to look up here and see what's available. What is your zip code?
62704.
Okay, and you are in Springfield?
Yes.
All right. So I'm looking up here to see what's closest to you, and I have one good possibility. It's the Crisis Nursery. It says Minnie O'Byrne Crisis Nursery. Would you like their phone number or address or both?
Of both.
Okay, so their phone number is area code 217-525-6800, and they're located at 1011 North 7th Street. Can I repeat any of that for you? Did you?
Yeah, I had to grab a pen. Can you do the phone number one more time for me?
Certainly. It's area code 217-525-6800.
Perfect. Yes, I got it that time. Thank you.
Okay, that's good. So I hope that helps out. Is there anything else that you need help with?
No, I think I'm okay. I just am running out of benefits, just waiting for things to restart.
Yes, it's getting towards the end of the month here, so I know how that can go. Before I let you go, we'd really like to do a follow-up call with people to find out if the referral turned out good for you. Do you allow us to make a follow-up call to you?
Yeah, that's fine.
Okay, what's your phone number?
217-331-8892.
Okay, and your first name?
Katrina.
Katrina, all right, Katrina. And if we call and may we leave a message on your machine?
Yes, that's fine.
You're not there? Okay, that's great. Thank you for agreeing to that. It's what helps keep 211 strong. Is there anything else that I can do for you?
No, but just for future reference, if I needed to call to help, like for help for my mom in a different county, could I call?
Absolutely. We have 211 in many counties throughout the state of Illinois. Our organization actually has 47 counties. And so you can call 211 in your area, and they will be able to tap into other resources. So I know when you have an older parent, there's a lot of issues that come up. So that's a great number to remember, 211. The other thing is that you can text us too by sending your zip code to TXT 211.
So then would I type in my mom's zip code if I need resources for her?
Yes, that would work out fine.
Okay. Well, thank you. I appreciate it.
All right. And remember, 211 is always here, and we're 24/7, 7 days a week.
Thanks.
Okay. Goodbye.
Well, that was really cool to hear that example. Now, I know I've personally had some phone anxiety in the past, so I know how tricky it can be for some folks to make a call and jot down all the notes you need. So this is why I love that 211 just rolled out text support. Now, all you've got to do is text your zip code to TXT211 or 898-211 to begin. Then you'll provide your age, gender, and what kind of services you're looking for. And providing that info just helps the operator locate the specific resources that will best be suited to you. There are so many different types of services out there, and each of them are managed by their own local agencies and have different protocols they need to follow. So this is how 211 helps you get the information you need that will fit you best. Now, other follow-up questions might also be asked. So, for example, if I texted looking for rental assistance, they might ask me if my income was impacted by COVID. This just helps the operator narrow that search and make sure that I have access to every resource that's available. After they've narrowed down the search, they can just text me the results. So there's no need to scramble and take notes. But sometimes when folks call or text, there may not be any current services available. So for the example of rental assistance, all the funds might be expended. So all the funds that were available have now been distributed to those in need. But once those funds become available again, that service will again be listed on 211. So the service might also not just be listed because they didn't fill out the 211 intake form. But this is why the AIRS standards help to ensure 211 stays as up to date as possible. Now, AIRS stands for Alliance of Information and Referral Systems. Now, beyond our local pushes to provide information, 211 contact centers must meet specific standards, which includes updating all records at least every 12 months. And those AIRS standards also protect client information by dictating what can and cannot be shared for reporting purposes. And that reporting really does come in handy. Katrina, do you want to talk a little bit about that?
Sure. Thanks, Mitch. 211 data is so important. It not only tells us what the greatest needs are in our community, but it helps us point to unmet needs that also happen and help us work to address them. However, the data is also important to the broader community, and that is why we love showing 211 counts. 211 counts is the first tool to provide real-time, searchable, and visual presentations of data from 211 contact centers across the nation. Using 211 counts, you'll find a snapshot of community-specific needs displayed by zip code, region, or contact center as recently as yesterday, enabling you to easily check trends, make comparisons, and share information. 211 Counts works with our local 211 to share this information with community leaders and service agencies. The 211 Counts dashboard has been able to help write grants, create up-to-date reports, and show evidence of the community's needs. While 211 Counts includes 211 systems as its users, the primary target for this information to be used is for government representatives, service agencies, and even philanthropic organizations to understand in near real time what people are calling for and are needing. There are so many functions of 211 that make this number critical to our community's success. We already discussed keeping information as up to date as possible and the provision of near real-time data. But 211 also has features that make sure our neighbors are taken care of while on the line. 211 helps us serve the rich diversity across our community and other communities across the country because it's equipped to handle more than 170 languages. Callers can interact with trained specialists how they are most comfortable. Additionally, to assist callers, warm transfers can also take place, helping to bridge the communication gap. The ability to do warm transfers is also critically important in the event of emergencies. While all operators must be trained to handle a myriad of situations from suicidal ideation to call seeking escape from domestic violence, it is important that they stabilize the caller right then, but then connect them with support teams that have deeper training and knowledge, like the suicide hotline or domestic violence hotline. 211 is easy to remember and can be the first step in seeking help.
Thanks, Katrina. I currently have the pleasure to serve as the chair of the 211 Illinois Board, the entity created by legislation when 211 came to Illinois on February 11, 2009. The 211 Board is made up of representation of a number of state agencies, local United Ways, and other social service organizations. We know through personal stories of people finding the help through 211 how important it is to ensure the state is fully covered, so every Illinois resident can find information they or a loved one in a different community needs. During 2020, 211 services were available in 55 of the 102 counties within the state of Illinois. 36% of Illinois residents have the service in their area. We hope this number will continue to grow as the means to cover the implementation and ongoing costs of the service are identified and allocated. COVID-19 highlighted the strength of 211 and also the need for statewide coverage. I'm happy to report that efforts are underway to make that happen. The City of Chicago and Cook County, under the leadership of the Metro United Way, has started a planning process. And our state board has posted an RFP seeking a consultant to look at statewide coverage and reliable funding strategies so we can finally join the 48 other states with complete statewide coverage. With that, I want to send a big thank you to our 211 provider, PATH, out of Bloomington, for all that they do to provide the services for our community, and as Karen shared, the 46 other counties they have. And I have a big thank you for having them join us this morning. On the next United We Learn, we will discuss how to live united, looking at how small actions make big impacts in our communities. This concludes today's program, and we will keep the session open for a few minutes to address any questions that have been posted to chat. Any questions we don't get to in the next few minutes will be addressed and saved on our website. Thank you. Have a great Friday and a wonderful weekend.